Hi and welcome. It's Jessica Drummond here from the Integrative Women's Health Institute. Today, I'm going to show you the 3 most essential steps to building your integrative women's health practice. And this information is based in science, not sort of the latest marketing hype out there. So let's jump in. Essentially, you need 3 specific skill sets in order to build a growing and solid, with a strong foundation, integrative women's health practice in your community or online. So, welcome to this webinar where we're going to dig into all 3 of those essential skill sets and really perspectives for working with women in a way that helps them to achieve their health goals in a sustainable way. So first, you need evidence-based training in nutrition and lifestyle medicine. Even if you're not a nutritionist, even if you're a physical therapist, a chiropractor, a naturopath, a fitness professional, and if you are a nutritionist, you certainly need this, and you need this continuing education specifically in this population. If you're a health coach, no matter your degree, certification, license, really, we cannot supplement, exercise, or medicate any of our patients or clients out of a bad diet. So we all have to have a foundational understanding of functional nutrition and lifestyle medicine. We can't be just following the fads in the media about nutrition, or even the latest, bestsellers at the bookstore or your library. Because, remember step aerobics and multitasking and low-fat margarine, right? We need to really start to understand the research and know that it may change, and that's okay. But we need to understand the whys, the whos, and how to implement, at least at a basic level, no matter what your degree, license, or certification is, if you're working in a women's health population of any kind, whether it's wellness or with women who do have disease states. Number 2, you need to develop strong evidence-based health coaching communication skills. I'm going to get into the details of why, but you also have to understand this specifically for female clients. It is different working with women than men. It is different working with women than children, for example. And, we talk a lot about patient compliance in women's healthcare. This is really the secret sauce. It's not really about patient compliance. It's about your patients and clients owning their own healing journey. And these health coach communication skills are the method for helping them do so, for you partnering with your clients rather than having a paternalistic approach, even if you don't feel like you're having that, right? You have to align your expectations with your clients' expectations so that your clients are really leading the charge. Wouldn't it be great to walk into your practice tomorrow and all of your clients be kind of pushing you with, how much they've done to accomplish their health goals, how, they've done their home exercises, they've done the in-between session stretching, they've really enjoyed eating healthy, delicious food in between their sessions with you, right? Because you can't follow them home. You need these skills. And third, again, if you're working with a population of women, you have to understand the modern practical challenges of women. And we all do to some degree, because most of us working in women's health are women ourselves. But a lot of times we haven't stopped and thought about this, even in our own lives. Honestly, the vast majority of the patients and clients in my practice are healthcare professionals. And we really, as a group, don't stop and notice the practical realities that women deal with, women with children, women going through transitions like moving or divorce or changing jobs, women in the professional world. We don't often take the time to consider how our lives as women impact our health. So if you are going to be a leader in women's health and wellness in your community, you have to have all three of these skill sets understood and well developed. And you've got to have a support network to help you grow these skills over time. So let's have some fun. At the end of this webinar, I have a special invitation for you. So I invite you to stay tuned through the end of this webinar. I would like you to please eliminate distractions. I'm as bad at this as anyone else, but please close all of your other windows, silence your cell phone notifications, and find a quiet place so that you can really pay attention and learn for the next little while we really dig into this stuff. It will really benefit your practice and maybe even your life. So let me tell you a bit about me if we haven't met before. So my name is Jessica Drummond. I'm the founder of the Integrative Women's Health Institute, and we've been around for almost 6 years now. And my childhood was pretty much spent in a gymnastics gym. I competed at a pretty high level up to about level 9, and I started competing when I was just 7 years old. So, outside of school and some time with my friends, I did a lot of gymnastics. Then in college, I actually got burned out. So here's a bit of a story of my life, right? Which many of you might be able to relate to. When I was 17, so my senior year of high school, I got mono twice and eventually burned out, stopped doing gymnastics, and stepped away from the sport. And when I went to college at the University of Virginia, I became a cheerleader just for fun, honestly, because one of my hall mates, one of the women on my hall, wanted to be a cheerleader. She'd been a high school cheerleader, so she dragged me to the tryouts with her. And then she did not join the cheerleading squad, but I did. I had a great time. I was an athletic trainer, and I did it just all for fun at UVA. But I was really focused. I was a go-getter, straight A student, but I was also kind of a partier in college. So, I was active and athletic, but really burning the candle at both ends in my 20s through college, through graduate school, work hard during the day, work out, study, and then, go out drinking and dancing at night. I eventually became an orthopedic physical therapist. And I later, actually quite early in my career, I specialized in women's health. About a year after I got out of graduate school, I began exploring women's health, and I did women's health full time, pretty much starting about 2 to 3 years after I got out of graduate school. Then in 2001, I got married. And a couple of years later, we had our first baby. You'll see my little redhead Claire right there in the swimming pool float thing. She's a teenager now, which is amazing to me. And that was really a trigger for me. I felt really generally pretty healthy. I had an active job as a physical therapist. My husband and I traveled. We did a lot of fun stuff with our friends, still had that kind of like work during the day, party at night lifestyle in my 20s. And then, when Claire was born, that was really a trigger for me. Postpartum recovery was rough, even though I had a great pregnancy, a great delivery, but postpartum recovery was rough. And Claire pretty much didn't sleep through the night till she was about 6. So I experienced what used to be called in functional medicine adrenal fatigue. It's essentially a dysfunction of the HPA axis, a significant hormonal imbalance. I had panic attacks, chronic pain, burnout, intense fatigue. And I actually had to quit my job for a while and just focus on my own healing, focus on taking care of my daughter. I didn't even have the energy to do that full time. So I had a lot of reliance on friends and family. We had to move to a place I could be near my functional doctor. And all of that taught me that we can't be healthy unless there is a solid functional nutrition and lifestyle foundation of health in our lives. And part of the sequela of my adrenal fatigue or HPA axis dysfunction was that I struggled with infertility, secondary infertility, for about 3 years. And then finally when my kids are actually 7 years apart, because so really it was more like 4 years. And, we waited a little while. I was so sick. I wasn't ready to have a baby, a year after my first daughter was born. But at age 37, I, founded the Integrative Women's Health Institute. Actually, a little bit before that, we incorporated in 2011, and I started working in this field in 2009. And my baby number 2, Kate, was born in 2010. So, I lived this before I started teaching it, and I learned it for myself because really I was very sick in my early 30s. And so if you've experienced a personal illness, you know that you're really motivated. And then I realized that, when I started back in my women's health physical therapy practice, there was so much of functional nutrition and health coaching that belonged in the practice of women's health and women's pelvic health in physical therapy and midwifery, in fitness, in all of these things that I was very comfortable with. And we were missing these 2 huge important pieces of the puzzle to support our clients' long-term health. So what do I know about running an integrative women's health practice? Well, I started working as a health coach and gaining my nutrition skills in 2009 in combination with my women's health physical therapy practice when I was finally healthy enough to kind of inch back to work. In 2011, I officially started my own private practice, and started the Training Institute, where I began teaching globally to healthcare professionals about how to use evidence-based integrative tools for women's healthcare, and I've been doing that ever since. So what I've learned over the years in talking to, probably thousands of practitioners now and working with hundreds to thousands of patients myself in the last couple of years, and thousands of patients before that. I mean, I've really been doing this almost 20 years now, which makes me sound old. I'm not really old. I'm very energetic. But, I was really sick. I saw a missing piece of the puzzle, and I realized that physical medicine, conventional allopathic medicine, which were the areas that I was originally trained in, were missing 3 key skill sets for helping women to heal from the root cause. Nutrition and lifestyle medicine. Sleep is so underrated. We have tons of evidence about the benefits of sleep and how to optimize sleep, and we don't use that enough in practice. Nutrition, social networks, stress management. All of these things are really kind of breezed by as like, oh yeah, that's nice, but take your pharmaceuticals. And they are actually in the data. These nutritional and lifestyle medicine tools, nutraceuticals, healthy diets, sleep hygiene and sleep strategies, social network building are in many, many cases in the research far more powerful than any drugs. And we are really underutilizing them in practice. Health coaching communication skills helps you to develop relationships with your patients and clients such that they are motivated. They're excited to get healthy. They're not like, oh, I'm so bored eating this, boring, healthy diet. I hate exercise. You want to be working with people that are excited about how healthy they're getting. And these skills help you to improve that compliance. And it's not really about compliance. It's about patients being excited to be healthy. I also realized as a young mother when I was really sick, how little we really talk about the demands on women, especially when they become mothers. The psychosocial demands, the emotional demands, the mental carrying around of information. I'm sure you more than your male partner probably thinks about, when the kids are growing out of the socks and when it's time to get more milk at the grocery store. There are so many jobs that women do, and we really underestimate the impact of that. And we under-support women who are doing big, great, amazing things in the world, which I'm hugely a fan of. And I'm a fan of, if you're doing that, that you're supported enough to do it without compromising your health. And then when you have these 3 missing piece skill sets, in addition to your allopathic training, to your fitness training, to all of your licenses and certifications, all of your other degrees, your clients get massive results. And even if you do nothing but this program, you're going to be hitting the foundation that like 80% of all women in the world need. So your clients are going to get great results. Thus, your practice is going to grow. Our practice has almost entirely grown by word of mouth. Referrals, marketing opportunities start to open up. People invite me to speak places because we get great results for our clients and they tell their friends. So step 1, women's health, nutrition, and lifestyle medicine from a functional medicine approach. This is not optional, even if you're not a nutritionist, but I'm not a nutritionist. This does not matter. Every clinician, health coach, fitness, and wellness professional needs to understand nutrition. Why? Because everyone eats, and nutrition is key to health. And as I've said, you can't medicate, exercise, or supplement your way out of a bad diet. If you are working in health or wellness, you need to have a strong functional nutrition background. And that has to include understanding functional labs. It doesn't mean that you order them. That may be outside of your scope of practice. You need to understand what your scope of practice is, which we talk a lot about in the Women's Health Coach Certification Program, because depending on your other training, your scope of practice will vary. But you definitely need to understand functional lab testing, who to go to collaborate with to do it if it is outside of your scope of practice, because there are some really valuable pieces of data that you can get and share with your clients that make a huge difference. Some of these minor tweaks based on your clients' genetics, based on their nutrient deficiencies, based on their hormonal imbalances, make a massive difference to their general health, their symptoms, their outcomes. So we definitely dig into that in the program, and we talk clearly about when it's appropriate for you to be partnering with other people in this space to look at those labs. But you need to know they're available and what they test for, and really understand them. Now, you don't have to know everything about nutrition, and our training includes important information about your scope of practice, and my attorney actually comes on and gives us a call about, you can ask all kinds of scope of practice questions. If you're coming to this program as a physical therapist or as a health coach, when is it appropriate to use nutrition? Which state practice act do you need to be looking at? Is it okay to do in your country? We understand those challenges and we address them head on in the program. Now, here's the thing. So we talked about like functional labs and recommending specific supplements and looking at hormones and looking at nutrient deficiencies and getting into the nitty-gritty and the details, right? The details do matter depending on the complexity of clients that you're working with. But here's the thing, even if you're working in, clinical practice, I had a friend of mine at the gym today kind of stop me and say, oh, my sister-in-law had a hip replacement and then she had complications of Guillain-Barré, but I don't know, like they're still feeding her like turkey sandwiches and applesauce and like Jell-O and stuff. And I'm like, oh, so even if your clients are very sick, very compromised, you're working in a hospital setting, and you would think that the doctors would be focused on really nourishing those clients. They're not. Almost everyone in your community, whether, they have a complex illness or they just want to lose a little weight or get their energy back after baby or something like that, most people surrounding you in your community have very poor nutrition. At least 1 in 4 people eat some kind of fast food every day. Americans consume 31% more packaged food than fresh food, and 20% of all American meals are eaten in the car. And these are just a few statistics. So what I say to professionals who are concerned about, how much nutrition should I be using in my practice? you need to understand it to a level of depth so that you can collaborate appropriately. And yet, you need to set the foundation. The vast majority of your patients are not even eating any fruits and vegetables. They're literally eating fast food and candy, right? And so we've got to build a foundation for every person that walks in the door of your practice. Very simple, but really important. And a lot of us don't really know how to cook or don't really know how to talk about this at a basic level within our clinical practices. And I had this problem, when I was practicing as a physical therapist and started realizing how important nutrition was. It's funny because my roommates from PT school are now, one's a physician and one's a physical therapist. And they were like, "You're talking about nutrition now?" They're like, "Oh my God." Because when I was in graduate school, literally I was known for as my specialty slice and bake cookies. Like, I did not know how to cook. The first meal I made for my husband was burnt hot dogs. I did not know how to cook for, a long time, probably until about 10 years into my marriage. And I had to learn because I got sick. And so in this program, you will fill in those gaps so that you really understand the basics of nutrition that the vast majority of your clients and patients need. Same thing with health coaching. You've got to set a really strong foundation, and the basics of nutrition are simply different for men than they are for women. They're different for people with different genetics. They're different for people with different deficiencies. They're different for people with different chronic illnesses. And you need to understand when to apply even the basics of nutrition and how, and we will teach you. So we have to help. The first step is to shift your clients to a real food diet. Get them off the fast food, candy, or the wine and caffeine diet. I was at a medical conference a couple of years ago, and I think I was lecturing to about 250 physicians, physical therapists, nutritionists, like licensed healthcare professionals, mostly for physicians at this conference. And I said, how many people in this room are on the coffee and wine diet? Meaning that they can't get up and move without coffee, like they're otherwise dragging in the morning, and they can't settle their bodies and go to sleep without wine. Well, of that room of 250, mostly physician and physical therapist health professionals, I would say 70% were on the coffee and wine diet. So one of the most interesting things we see in our program is that the professionals who join the program begin to apply the information to themselves first, and they begin to experience significant health gains themselves. And then you can more excitedly communicate the results and inspire your clients. So this is more of an issue of having strong health coaching communication skills versus having highly skilled nutrition knowledge. You'll get both, but you'll need to understand when to use them. All right, so we'll keep talking about nutrition for a little bit, and I'll get more into that in step 2. So you need to understand the core concepts in nutrition. Digestive function. You can be eating the best, most beautiful whole foods diet, nutrient dense, but if your client's digestive function is not optimal, they can't absorb all of that wonderful food. Same thing, immune function. Finally, we're talking about immune function in chronic pain. I worked in chronic pelvic pain. I still do. A large majority of my clients have chronic pelvic pain. Chronic pain is intimately related to immune function. So if your clients are in pain, fatigued, get colds and flus all the time, we need to understand how is their immune system functioning. We need to look at the impact of nutrition on the nervous system, the cardiovascular system. Women, their number one mortality risk, number one cause of death in women is still heart disease. So we can't overlook the cardiovascular system, musculoskeletal system, and hormone systems. You'll learn how to critically read nutrition research. Where was the funding source? What was the power of the study? Were there any significant conflicts of interest? And what are the mechanisms of the impact of the food on the biochemistry? So when you're eating, that nourishing salad, what is it actually doing at a biochemical level? Our understanding continuously evolves. So even if some aspects of this are outside of your scope of practice, you need to support your clients with quality education no matter what, no matter if you're a coach, if you're a clinician, what your license is, what your certification is. You need quality education regarding functional testing, cooking, and other resources, supplement safety and quality. What are good brands? Don't just send your clients to Walmart to buy their supplements. How to determine benefits and risks of various dietary recommendations to individual clients who might be pregnant or have a women's health condition or have other risk factors. And even again, if some of these issues are outside of the scope of practice, then you need to learn how to create networks so you have quality referral sources for your clients. I collaborate all the time with other healing practitioners with my clients. And so you'll understand important questions to ask her physician, her nutritionist, her herbalist, her naturopath, her physical therapist, all of the different people on her professional healing team. And at the end of the day, functional nutrition is about a lot more than food and supplements. Functional nutrition is about nourishment. And so you need to understand the other lifestyle factors that nourish women: sleep, earthing, which is connecting to nature, work stress, mindfulness, support networks, relationship stress. We're learning a lot about social networks and how, things like obesity and even gun violence can spread via social networks, trauma history, and more. Understanding how to educate and coach clients to nourish themselves with lifestyle medicine often is the key to getting to the root cause of the health concern. Then every single clinician, coach, or wellness practitioner needs to understand health coaching communication skills for women. This is the secret sauce to quote unquote patient compliance. Here's the thing. Health coaching skills are specific communication skills that are based in peer-reviewed research. Coaching is a distinct therapeutic relationship with clear ethics and boundaries. This is not a friendly chat, and this is not psychotherapy. It's also not purely education. So why does every health or wellness professional need these skills? So you need to have language for creating a match between your patient or client expectations and your expectations as a practitioner. So, for example, there was a physical therapist in our training program who said to me the other day, she was like, I have this guy, we're working on his knee pain, and every time he comes in, he's like so excited, he's ready to get better, but then I send him home with a home exercise and lifestyle program, and he never does it. And I say, well, why do you think he's so excited to do his exercises? She's like, well, he just seems really ready to get better. And I said, well, have you talked to him about how he sees himself getting better, what his role is going to be in the journey? And she was like, no. I said, so really, if you think about it, is his expectation that he's going to come to you, you're going to do some kind of a magic manual therapy technique or techniques, and he's going to go home with his knee feeling better? And she's like, yes, that's exactly what he thinks and expects and hopes. And, I see this all the time. Clients say, I came to you because I was expecting a miracle. I was expecting you have the magic touch, right? And in almost every case of chronic illness that I've seen in the last 20 years, there's not a magic supplement, a magic dietary plan, a magic pharmaceutical, a magic surgery, a magic physical therapy technique or manual therapy technique or bodywork technique. It is a process. It is a shift in how the client takes care of themselves on a daily basis via a number of factors: nutrition, movement, bodywork and manual therapy. Pharmaceuticals may even be part of the process. Surgery may be part of the process. But you need to have a language for communicating that your client's participation is central to your work together. And you have to understand what your client is most interested in, because they're probably not as interested in the details of their biochemistry as you are. So what are their real goals? What are their real functional plans in life? And you have to have the language to really dive into those and figure out what it is from her perspective, not from your expectation or your guess or what your perspective would be in her situation, because we want to match how we're working with clients to clients who are really motivated to work with us for their benefit towards a specific goal that is, defined really by her. Then your client will be empowered to self-correct when she stops using some of the tools, like she goes on vacation or, she kind of falls off the wagon in some way. She'll have this empowered mindset where you're helping her, but you're not like dragging her to health. The healing relationship is based in the patient and client's commitment to healing. You simply can't want it more than she does. You are not everyone's healer. So we have to have the communication skills to learn to connect our client's physical health goals with her particular life goals. By quote unquote teaching your client to fish, your clinical work becomes easier and more rewarding. And my students have said over the years, they feel like they give better informed consent. They feel like they're working with a population of clients who are more motivated. Their population hasn't changed, just their relationships with their clients have changed. They feel much less stress at work. They feel much less burden of being the quote unquote fixer in situations where that's impossible, which is essentially all situations, as you'll learn. Other than maybe when your client is unconscious and in trauma. If you're an ER trauma surgeon, that's a little bit different. But with chronic illness, my clients, my students are so much happier once they start to implement these skills in their practice, because they end up working with a more motivated population, even if that population doesn't change. So as I said, I give my students have said, I give much better informed consent. I no longer assume that my patient will go home and do what I recommend. I have tools to be sure that they will, because they're excited. And we've already considered the potential barriers to taking action. They always tell me, my students are constantly telling me, I feel so much less burned out because I understand now that I can't fix everyone if they don't want to participate. Whereas, I had this perspective too when I first started working as a physical therapist, that if my clients didn't get better, I was somehow a failure. And once you learn these tools, you will understand that that's simply not true. And every women's health specialist, clinician or coach or wellness professional must understand the modern demands on working women. Most of the students in my program are working mothers, working women themselves. And so you already know this because you're living it. But each case is unique. So you need to know the data, not just your experience. Your experience is important. Thus, we support you to optimize your own health along the way to be a living, imperfect inspiration to your clients. No one here is perfect. But the truth is, 70% of mothers work outside of the home. 12% of women are caregivers to adult family members. Women are the healthcare CEOs of the family. They make the majority of the decisions about healthcare for every member of their family. And women are doing the majority of the cooking, not to mention the majority of the household work and childcare. So when you make recommendations to women about their health, you're going to be far more effective if you understand and anticipate the practical barriers to change due to the challenges of work, home care, child care, elder care. And as you consider these practical barriers to change in your own life and practice health promoting strategies despite these potential challenges, you learn how this can be done in the context of a life as a busy working woman. So what we find then is in your practice, you have this holistic, integrative, patient-centered approach. You're using evidence-based nutrition, exercise, and lifestyle medicine and functional biometric testing. You're using assessment tools and strategies. You have all these tools in your toolbox from this program to support root cause healing of common women's health concerns. And we talk about a really wide variety of common women's health concerns in this program. And often you are collaborating with other clinicians and health and wellness professionals. Then you're going to have this population of empowered, motivated patients, right? Even if you don't change jobs, that participate actively in their healing, dramatically reducing your stress. So let me talk through a case study. This client of ours was a 45-year-old woman. She was referred by her physical therapist and also working with a functional medicine physician. Her current complaints are fatigue, anxiety, unstable moods, insomnia, constipation, bloating, chronically since high school, hair loss, chronic foot pain, heart palpitations, chronic cough and cold, brain fog, feelings of overwhelm, feelings of I haven't slept in 5 years since the birth of her youngest child. I have bursts of fake energy, she told me, in an attempt to have a happy home. She was grumpy, this poor woman, and she knew it, and she didn't want to be. She was like, I am such a grouch to my whole family. I don't want to be. I have these fake bursts of happy energy because I don't want to ruin everything, but I really feel awful. Her medical history was that she had her son at 41 years old and also has a 14-year-old daughter from a previous marriage. Since having her son, she reports feeling overwhelmed 100% of the time and usually suffering with a cough or cold. She also reports insomnia with fatigue during the day. Newly diagnosed with Hashimoto's, thyroiditis, and increased intestinal permeability, otherwise known as leaky gut. All of these were suspected and tested for by her functional medicine physician. We do these things in our practice too, but I was collaborating with a local physician in her area. She also complains of nerve pain in her foot, cardiac arrhythmia, and palpitation. She'd been on some hormone replacement therapy with her functional medicine physician, but couldn't tolerate it due to breast soreness, painful periods, and decreased length of her menstrual cycle down to as low as 15 days. So what did we do? We used the tools of evidence-based nutrition and lifestyle medicine within the scope of the practice of our practice and in collaboration with her local team. We used expert health coaching communication skills and that depth of understanding of this particular woman's practical challenges. She's a mom of a 5-year-old son and a teen. This is her second marriage. She's working part-time. How is that working for her in her life? And so that sounds like a pretty complex case when I read through her medical history, right? But if we just think through these 3 key toolboxes, key 3 skill sets that we use in every health coaching interaction, there's no need to be overwhelmed, even with complex cases like these. So let's walk through my functional assessment of this client. So let's consider her nutrition. When I first met this patient, she'd been sugar, gluten, dairy, and soy-free already for 2 months. She'd been eating mostly organic foods and rarely drank alcohol. If we looked at her functional lab, she had nutrient deficiencies in vitamin D, iron, magnesium, B vitamins, selenium, antioxidants, and amino acids, a pretty big laundry list there. She had dysbiosis on her stool test and abnormal thyroid and adrenal hormone levels. Plus, she had numerous genetic SNPs, single nucleotide polymorphisms, which we'll get into in the program. Sleep, she hadn't slept through the night since the birth of her son more than 5 years ago. But fortunately, she has a great support network of her local healthcare team, her physician, her physical therapist, and her local home team, her spouse and her friends. Exercise, she's not doing any exercise except for some physical therapy exercises for her foot pain. So we use a tool called the Holistic Women's Health Assessment in walking our clients through these various domains of health. The first is perspective. Is she optimistic about her healing? And this client she was optimistic, but only at a 5 out of 10 level because she really felt overwhelmed since the birth of her son. Connection. Yes, she had good professional and personal support, so she rated that as an 8 out of 10. Nourishment, as you could see from her lab, she had significant nutrient deficiencies, digestive function challenges, but she was on a whole foods and low inflammatory diet for the last couple of months, so she rated that 5 out of 10. Strength, no exercise, but good emotional resilience with a strong support network, so she ranked that 6 out of 10. Contribution, here she was feeling like a little bit of a struggle. She'd like to be more present with her family. She feels like she's running all the time. Work, her activities, their activities, household chores, just like getting through the day most of the time. But she does enjoy her family when she doesn't feel exhausted. So she rated that 6 out of 10. Attention, worsening brain fog, insomnia, fatigue, and anxiety over the past 12 months. She did not feel like attentive at all. Her brain was kind of all over the place. So she rated that 4 out of 10. And rest, I wake up tired and I haven't slept through the night since my son was born. So I'm going to rate that 4 out of 10. So this is the tool that we use, and we have a number of tools we'll share with you inside the program. So how do we use these 3 key steps? Step 1, evidence-based nutrition and lifestyle medicine. So we're going to optimize her nutrition and supplement plan using research-based and practical suggestions. So at first, there's no need for excessive testing. She's had some testing with her functional medicine physician locally, so we can utilize that, really focus on those nutrient deficiency areas. We want to be focused on valid and reliable labs. Not all of the functional labs are validated or very reliable, so we have to be cognizant of the limitations of functional labs. We want to, in her case, focus a lot on digestive and immune function and minimize the complexity of the recommendations because she's already fatigued and living a very busy life. Sleep and circadian rhythms are key for this patient. We need to build her a strong web of support, and I call this now the web of support and safety. She needs to feel like people are helping her with her sleep, especially. And when we worked through a slow progression into safe exercise. Then I utilized those health coaching communication skills. I connected her healing plan to her very specific vision for what a wonderful life with her family would look like. We predicted and supported navigating specific obstacles, like her late period, the challenges of having her period on a family vacation. She had a jaw pain incident. She had a minor car accident. So we were navigating obstacles and barriers to change because, you can map out the plan, right? And then life happens. And so we have to help our clients be able to navigate through those not so perfect days. And we discussed the client's willingness and ability to implement these changes over time, really giving her ownership of her program. And there are specific communication tools we use, certain powerful questions, reflections, pulling in her skill sets, the things she's utilized in other parts of her life to be successful. And visiting her beliefs. Does she really believe that she has the capacity to heal? What were her family's beliefs about health and healing? What are her family's beliefs about the roles of women? All of these things are important factors. And the coaching program really dives into all of these skills and all of your clients' baggage that they come with, right? Because we need to overcome that and also capitalize on the strengths that they come with. So baby steps to more transformative, permanent actions. And finally, again, understanding the modern demands on each specific woman that is in your practice. This particular woman is a mother in a blended family. She had her second baby at 41 years old. She's breastfeeding and perimenopausal. Sounds familiar sometimes, right? Challenges with a teenage daughter, realistic mindfulness and exercise goals. She has a lot on her plate already. So the results for this particular client, she had a streamlined and consistent food and supplement plan, a dramatic sleep and circadian rhythm improvement. She significantly reduced her fatigue. She became less and less dependent on accountability to me. She has structures in place now for self-accountability. She's empowered and confident. She became increasingly empowered and confident after kind of showing up being like, I'm such a mess, like landing on my door feeling like just a mess. Now she's like empowered and confident. She's the leader of her professional health team and can use them as needed over time, including my nutrition suggestions, including her functional medicine physician, including her physical therapist and fitness professionals. She added yoga teachers to her team. She's empowered in her life as a mother, in her wonderful family. She's much happier. Her health improved 80% by the time we kind of put her on a maintenance program. Much better sleep with less fatigue, less anxiety, much less unstable moods. Her brain fog was gone. Her insomnia was much better, other than the occasional night her son was still crawling into bed with her. Her hair was thicker, her digestive function is normal, her osteoarthritic pain was much less, even including a setback with the car accident. So, in conclusion, developing strong skills in all three of these skill sets is essential to getting your complex and common women's health clients with chronic health concerns healthier. Just think about the women in your life. How many of them are dealing with little nagging things or big nagging things that they just don't have the capacity, the understanding, the support network? They don't have a great women's health coach in their life to get to that root cause healing, because they need practitioners who understand all three of these skill sets at a very deep level. Nutrition and lifestyle medicine that is research-based, not based on media hype. Health coach communication skills, and a depth of knowledge regarding the evidence and each individual woman's practical challenges. At the end of the day, when your clients get good results, your practice grows. When your clients are empowered, you are less burned out and far more confident. As you can see, this approach of taking these three essential skills toolboxes can be so effective, even with complex patients and clients with a number of chronic health conditions. And clearly this approach works just as well for women who have simpler challenges, but who really have struggled with them over the long term in their lives, including things like weight loss struggles, energy struggles, fatigue issues, chronic joint and back pain kinds of issues, and other very specific women's health conditions. So to learn more, I encourage you to join our Women's Health Coach certification. This is the only health coach certification in the world that focuses on all three essential skill sets specifically for women's health professionals. Am I qualified to teach you this? I hope you'll find that I am. I've been an invited speaker at top conferences for women's health professionals for the last, 10, 15 years. I've spoken twice at the American Physical Therapy Association's Combined Sections meeting. I've been invited to speak at the International Pelvic Pain Society's annual meeting. I've spoken at lots of smaller clinic and conferences all over the world in Ireland, California, New Jersey, Texas, New York, London. This year I'm invited to go speak in Turkey. So, I've been educating health and wellness professionals on these three skill sets for more than a decade, really closer to 15 years. I've also been an invited guest on major podcasts, including The Pelvic Messenger, Couch Talk with Dr. Anna Cabeca, the Future of Healing's online conference, the Healing Pain Summit, and many, many more. And, my background is really diverse in terms of the education and training that I've had. I have a bachelor's degree in science in biology from the University of Virginia. My master's is in physical therapy from Emory University. I have over 12 years of women's health physical therapy experience, actually again, closer to 15, 17 now. I have health coach certifications from the Institute of Integrative Nutrition and Duke Integrative Medicine. I've spent over 5 years running an integrative practice in functional nutrition and coaching for specifically women's health concerns, including chronic pelvic pain, 4 years of international integrative women's healthcare professional teaching experience. And again, at this point, it's even more than that. I will be graduating this year in 2017 with my doctorate in functional nutrition. And I've authored textbook chapters, including Functional Nutrition for Pelvic Pain, which is a recent chapter in a textbook called Healing in Urology. Now, enough about me. I hope that has convinced you that I'm qualified to teach you this. So who is this program for? This program is for physical therapists, occupational therapists, chiropractors, clinical dietitians and nutritionists, health coaches who specifically want to deepen their skills or want to focus on a women's health specialty or niche market, fitness professionals, athletic trainers, yoga instructors, physicians, naturopaths, midwives, physician assistants, nurses, really any health or wellness professional who works with women's health clients. If you want to work with women, this is the specific approach that this program focuses on, and we want to help you to build your practice in that area. It doesn't mean you only have to work with women, but if you want to grow the parts of your practice that do focus on women's health, this is the right training for you. The program includes over 100 hours of content, 27 modules. It spans evidence-based health coaching skills, modern practical challenges for women, and again, evidence-based functional nutrition and lifestyle medicine skills. It's fully online. It can be completed at your own pace over 9 to 12 months. You'll receive bi-monthly live Q&A calls. That's a bit of a typo. Extended support from our faculty, current students, and global alumni. Once you're in this program, you're invited to stay in it for life. So if we update it, if you want to come to all the calls next year, if you want to stay in our Facebook group, like once you are a part of our community, you are a part of our community. So we are here to support you for the long term. We offer CEUs for certain professions, and that's always increasing. And there are exams and certificates of completion for the program. So in part 1 of the program, we'll be focusing on your women's health coaching communication skills. These 19 modules, as I have mentioned, are the secret sauce for compliance and patient empowerment. We'll focus on visioning, value setting, mindful listening, reflections, powerful questions, overcoming barriers to change, working with your client's inner critic and your own, goal setting and accountability, narrative medicine, motivational interviewing, and much, much more. And again, we always look through the lens of women's health. So we look at the research. Has it been tested in women? Have women been parts of these studies? Women in what phases of their life? What socioeconomic conditions? We really look in depth from a perspective of working with women. And so in part 2 of the program, we look at women's health, functional nutrition, and lifestyle medicine skills. This is the functional nutrition model applied specifically to women. Again, that's how we look, the lens through which we look at the research and our clinical practice. Evidence-based sex differences in the stress response and mind-body medicine to reduce stress in women. Optimizing digestive function and supporting healthy nutrition through the lifespan, minimizing cardiovascular disease risk in women and women's cardiovascular health, autoimmune disease in women, nutrition and lifestyle medicine to support immune health, women's hormonal health from puberty through pregnancy, fertility, postpartum, and menopause, psychoneuroimmunology for women, women and mood disorders, also some of this neurologic stuff applies to our chronic pain and chronic fatigue clients, and creating a health coaching practice that serves the women in your community and nourishes you to prevent compassion fatigue and burnout in your own body and your own life. And then, you'll be able to look at a woman at any stage of life and think about this systems approach to getting her root cause healing. So what can you do with this training? You can start your own women's health coach practice in an in-demand niche market. You can add health coaching, nutrition, and lifestyle medicine skills to your current clinical practice. So if you are currently working as a fitness professional or a physical therapist or a body worker of some kind, you can add this kind of practice to your practice. You'll get better compliance, more motivated population, reduce your own compassion fatigue and burnout while getting better results for your patients and clients. You can also add an online revenue stream or group program revenue stream to your one-on-one fitness, wellness, or other clinical practice. You can write, speak, or teach, launching a career as a women's wellness expert in person or online. And we've had a number of our students absolutely go on to do this and become global experts in their own fields. So the details about the program pricing, dates, and other frequently asked questions are listed in detail below this video on the page. Payment plans are available. Pricing details are listed below. We do have fast action early enrollment discounts, and we provide full support of our faculty, of our students. Our alumni communities are all there to support you for years to come. Once you join this program, as I said, you are in it. We don't kick you out after 9 months or a year. We are there to support you for the long term because we want to see you be successful. Thank you so much for joining me today. We covered the 3 essential skill sets that you need to build a solid, respected, sought-after integrative women's health practice with integrity and confidence, not just based on the latest fitness or nutrition fads. Deepening your skills in health coach communication, functional nutrition and lifestyle medicine, and integrating all of that with the modern demands on women that affect their health. All of these 3 tool sets together will make you a strong, industry-leading women's health and wellness professional. It was absolutely my pleasure to share this important information with you. I look forward to getting to know you better and supporting you to grow your integrative women's health practice, helping more women to live vibrant and healthy lives. To get all the details about the Women's Health Coach Certification Program, please read on below. Thanks so much. Have a great day. Bye-bye.